of us know something about mental disorders, like OCD or social anxiety. However, for every well-known diagnosis, there's a handful of others, mainly coming out of 20th century Freudian psychology, that haven't achieved that level of notoriety. Here's 10 of the most bizarre psychological disorders ever diagnosed by a doctor. 1. Split brain. This is a condition occurring when the corpus callosum, the bundle of nerves connecting the left and right brain, is cut. This can be done intentionally to prevent epileptic seizures, but can also result in complications including problems with physical coordination, information processing, and even split personality. 2. Cotard's syndrome, aka Cotard's delusion. Discovered by Dr. Jules Cotard in the 1880s, patients with this delusion believe that they have died or ceased to exist, even requesting their own funerals. This usually occurs alongside other disorders such as schizophrenia or depression, and can be treated with medication and electroconvulsive therapy. 3. Fregoli delusion. Commonly occurring alongside schizophrenia, this is a delusion that one is being haunted by a single person in disguise as several others, such as doctors and family. 4. Stendhal syndrome. Named after the famous French writer who became delirious while viewing art in Florence, patients may experience dizziness, fainting, even hallucinations when presented with objects of emotional significance. 5. Dissociative identity disorder. This one you may have heard of as multiple personality disorder, where a person cycles between separate personalities, often entering into a fugue state when they can't remember what happened. 6. Alice in Wonderland syndrome. This strangely named affliction entails a large set of conditions where patients' perceptions of time and body are distorted, like Alice's growing and shrinking. 7. Reduplicative paramnesia. This is a variety of delusion related to the brain damage of certain strokes, where a patient believes that a familiar place, usually their home, has been duplicated or disguised. 8. Lima syndrome. The opposite of the better-known Stockholm syndrome, Lima syndrome occurs when captors sympathize and identify with their hostage or victim. It gets its name from Peruvian psychiatrist Manuel Quirol, whose kidnappers turned to him for psychological advice, and eventually ended up setting him free. They even gave him cab fare. 9. Triskaidekaphobia. For some people, the number 13 is unlucky, but for people suffering from this stress reaction, it can induce panic attacks, often as part of a larger stress disorder. 10. The jumping Frenchman of Maine. This is an as-yet unclassified disorder diagnosed in French-Canadian lumberjacks who showed unusually strong reactions to surprise, with anything sudden making them jump uncontrollably. Other symptoms included random bursts of mimicry, similar to dissociative identity disorder, and suddenly obeying small commands. That's it, folks. Which of these rare disorders did you find interesting and want us to elaborate more on?